Assalamualaikum everyone. Today you will get information about the spinal cord lesions. That's the second part of our topic that relates to spinal cord lesion. First of all, I am going to provide information about some kind of complications that caused by the blood supply defects in the spinal cord. First of all, look at the spinal cord is supplied by blood by three arteries. First one is anterior spinal artery. Second and third ones are posterior spinal arteries. Okay, and today we will talk about the occlusion of the anterior spinal artery and clinical signs of these symptoms. Okay, of this defect. Okay, and first defect that's due to upper motor neuron deficit. You know, the cerebrum and spinal cord connect with via white matter and some kind of fibers, spinothalamic and corticospinal tracts and so on. Okay, and when the anterior spinal artery is occluded, it can cause its serious damage to the white matter of this part of the spinal cord, and with some kind of defects in the corticospinal tracts, upper motor neuron deficit can be caused. Look at that, and this white matter couldn't conduct any impulses from the cerebrum to the spinal cord due to this lesion. And plus this white matter couldn't conduct the impulses from the spinal cord to the thalamus. Because of this deficit, loss of pain and temperature sensation below this lesion. When if the lesion located in the thorax 7 and below the thorax 7, you couldn't feel any temperature and pain sensation. Okay, it's temperature and pain sensation. Okay, and the next lesion is due to lower motor neuron deficit. And the lower motor neuron, you know, as lower motor neurons located the anterior horn of the spinal cord, you can find out that anterior spinal artery occlusion can cause its harmful effect to the anterior horn. Okay, and due to the lower motor neuron deficit, we can see in the patient the flaccid paralysis. The alpha motor neurons couldn't respond to any stimuli, and it can be analyzed. Look at the level of the lesion. If the lesion between the thorax 7 and the lumbalis 2, this lower motor neuron deficit can be seen only this part, not anywhere. Okay. And second, our deficiency and our symptoms that are vitamin B12 deficiency. And the vitamin B12, you know, is necessary for multiplying of cells and some kind of is necessary for normal function of the nervous system. Most specifically, when the vitamin B12 isn't sufficient in the human organism, it can cause its harmful effect by demyelination of the spinocerebellar, posterior column, and corticospinal tracts. And due to these tracts and structures, the symptoms can be caused. Okay, first of all, due to the spinocerebellar tract demyelination, we can see some kind of ataxic gait. You know, the ataxic gait is unbalanced gait. It looks like some kind of patients couldn't balance their movements. It is not coordinated. Okay, due to the spinocerebellar tract located there. You know. Okay, and the next symptoms due to the posterior column demyelination, impaired position and vibratory sense. In our previous lesson, we talked about the function of the posterior column. Posterior column's main function is conducting proprioceptors that we can feel them. Okay, the proprioceptors that carry information that feel them about the position and vibratory sense. You couldn't feel by blinking your eyes your muscles tension and some kind of things on your on the bottom of your foot and something like that. And next symptom is corticospinal tract. Corticospinal tract is located there. If you remember clearly, we provide information about in our previous lessons about this tract. Its main function is connecting the cerebrum and the spinal cord. It can cause some kind of impairment of some movements. Our third information about the 𝙲𝙾𝙼𝙸𝙻𝙴 syndrome. The spinal cord located in the inner part of the spinal column on the vertebra, okay, and some kind of hernias or tumors can impinge on the normal structure of the spinal cord. The 𝙲𝙾𝙼𝙸𝙻𝙴 syndrome caused by the compression of the spinal cord at level L2 and below this, okay. And there are three main symptoms can be seen by neuropathologists. First one is loss of knee and ankle jack reflex. The knee and ankle jack reflexes can provide us so many information about the nerve fibers conduction ability. All of these reflex knee and ankle jack reflexes can be performed, can be seen by neuropathologists when the fibers that located L2 and below this level fibers perform their function normally. Because of some kind of compression at this level, we couldn't find out the knee and ankle jack reflexes, okay? And the next symptom is, second symptom is loss of bladder and sphincter control. Both of sphincters, bladder and sphincter control, anal sphincters is controlled and innervated by the fibers that located to the L2 and below this level, okay? And the third and last symptom in the 𝙲𝙾𝙼𝙸𝙻𝙴 is cerebral anesthesia. When you ride bicycle, your main part of the body connect with the saddle, and specifically this part is become anesthetized, okay, due to the compression of the nerve fibers at the L2 and below this level, okay. Our last information about amyotrophic lateral sclerosis. Amyotrophic lateral sclerosis is large topic to talk about, but in this lesson I'm going to provide the main parts of this disease, okay. There is two combined lesions, corticobulbar, corticospinal, and medullary and spinal control degeneration. According to the symptoms, I try to explain this, okay. The corticobulbar and corticospinal tracts connect the cerebrum with the spinal cord, and the spinal cord supply the muscles, okay. That's corticospinal and corticobulbar tracts, and there is the lower motor neurons, and both of structures can be degenerated in the amyotrophic lateral sclerosis, okay. And the symptoms due to the lower motor neuron lesions, and the lower motor neurons located in the brain stem and the spinal cord, and due to their lesion, the patient had difficulty, some kind of speech, and some kind of eating and fagging something, and some kind of limb weakness and atrophy due to some kind of lower motor neuron lesions. In our previous lesson, I provided information about the axonal transport, and their main function is supplying the muscles with energy, okay. When the axonal transport is normal, and the muscles can be metabolized some kind of glucose or proteins normally, and it can keep its structure, okay, without lower motor neuron activity, they can be atrophied. Okay, and the upper motor neuron deficit due to the corticobulbar and corticospinal tract deficits, and these are this figure, the motor homunculus located there, and for speech and eating something, the motor homunculus become activated by beta cells, of course, and all those beta cells activated, they couldn't conduct their impulses to the lower motor neurons, and these are this figure can be caused by, and spastic gait and clonus can be caused by the overactivity of the lower motor neurons. In our previous lesson, I talked about that the upper motor neurons always suppress, inhibit the activity of the lower motor neurons. Without this inhibitory effects, the lower motor neurons can be overactivated and they can cause spasticity and clonus in our body. All of our information that prepared and related to our topic is all. Thanks for listening and watching. Take care of yourself. See you next time.